Hello, everyone, and welcome to Headwise, the weekly videocast and podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel. I'm the founder of Migraine Nation, and I have a history of chronic and daily migraine that began at the age of 4. Our episode today has something for everyone. We'll be talking about new daily persistent headache, or NDPH as most of us know it, with both a leading advocate in the NDPH space and a leading headache doctor. Alan Kaplan is an advocate who battles NDPH. He has taken his suffering and used it to help change things for other people like him. He is the founder of NDPHaware, which is a nonprofit dedicated to research and education about NDPH. Hello, Alan. Thank you for being with us.
Hi, Lindsay. Thank you.
We also have with us today Dr. Mark Burish. Hi, Dr. Burish. How are you?
Good.
Dr. Burish is a board-certified neurologist and a pain medicine specialist whose research focuses on headache. I am excited about this episode for many reasons. One is that we do not often get to address the NDPH community. There's just not as much research or new announcements for me to come and get excited about and tell everyone about. So when there is something, we jump on it. These disorders that are not as common as migraine, like NDPH, our cluster, just don't have the money behind them to do the research, etc. So today, the reason we have Alan and Dr. Burish is they got together and they have put together a survey called the NDPH Patient Experience Survey, and they have worked hard to launch it. So today we are going to talk about what NDPH is, how it affects people, and then at the end, we're going to talk about how you can help by becoming involved in this survey and in this research. So, Dr. Burish, let's start with you. Can you please tell us what NDPH is exactly? It can be a little confusing to a lot of us because it often has the characteristics of another headache disorder like migraine or tension headache.
Yeah, so new daily persistent headache is a benign or theoretically harmless headache in the sense that it's not dangerous and won't lead to a cancer or a stroke. I think patients will tell you it's not really harmless because it can have such effect on your life. But the name new daily persistent headache is actually a pretty good name for it. It's a new headache that's daily and never goes away. So officially, there's 4 required components. So first, you need a headache. That's kind of obvious. Second, you've ruled out head bleeds and other things, also kind of obvious. Third, the pain has to be continuous within 24 hours of starting and has to have lasted at least 3 months. And then last, and this is kind of an odd one, you clearly remember the moment the headache starts. And that kind of sounds odd, but the moment it starts seems to be crystallized in many people's minds.
Okay. Now, when they remember the moment it starts, now this has always been a curiosity for me, are these people that always had a previous headache disorder like migraine and then they get one day and they're like, oh my gosh, that one never went away? Or do they usually not have previous headache problems?
It's a little bit of each. It seems like that new daily persistent headache, NDPH, doesn't prevent you from having other types of headaches. You can also have migraines beforehand, but some people, they've never had a headache, really any significant amount of headaches before, and then they suddenly get one day.
Okay. So is that the cue if someone's watching right now and they're like, wow, gosh, do I have migraine or do I have NDPH? Is it usually that you remember that day that it started?
That's a lot of it. Yeah, there's definitely overlap. Many patients with new day NDPH have the migraine types of headaches with nausea, light sensitivity, noise sensitivity, motion sensitivity, but yeah, those NDPH headaches become continuous within 24 hours. That's pretty unusual for migraine. Usually they'll go away at some point. So one of the questions I often ask NDPH patients is, when is the last time you did not have a headache? And those patients will often say something like 6 years ago. Migraine patients will often say, well, last week I had a day where I didn't have a headache.
Okay. That's actually a good question. I'm glad that you said that. So Alan, can you please tell us your NDPH story? We'd like to know what it was like for you when it first began and what it's been like living with NDPH.
Sure. My NDPH started in December of 2017.
Mhm.
So I don't have the exact date. I know it was in the beginning of December, and I just had some cataract surgery done.
Mhm.
And sometime in between the first eye and the second eye, that I realized I had a headache that was just not going anywhere. I wasn't,
Mhm.
it was just there and it hasn't stopped. And it just kept persisting on and on and on and on. And even after the second one, my wife thought at that point that that's what caused the headache was the surgery. Um, Everybody I talk to says that's probably not possible, but we really don't know 100%. So kept going on, and in January I'm like, okay, what do I do now? It's I've had sinus issues in the past. I've allergy issues in the past. I figured, okay, let me just go see an allergist. Did all the tests, nothing. Went to my ear, nose, throat guy, who knows my history, obviously, of sinus headache and polyps and all that kind of stuff. Checked me out, sent me for a CAT scan. Everything was clean as a whistle. So he basically was the first one to say this is possibly a headache issue, not a sinus issue.
Mhm.
So from there, I went to my GP, who put me on, I think, gabapentin at that time, and maybe Topamax. I'm not 100% sure about that.
Mhm.
And a couple months later, I had an episode where I thought I was having a stroke. I was getting a lot of tingling, and things were going on in my body. So I didn't understand. I was getting tingling on my side, down my arms, my feet. Went to the hospital. I saw a neurologist there. They did all, a CAT scan, and they did some MRIs, and they didn't diagnose me with NDPH at that point. They just said it was a headache disorder or something. Um, and then finally got a hold of a headache specialist who started treating me as if, I guess they're not going to give you a diagnosis unless you're at least 3 months out anyway.
Mhm.
Uh, so they start treating you as if you had migraine. So
Mhm.
getting all the migraine meds, I'm getting, the devices and MRI, MRA, MRV, name it. I pretty much had it all done. Um, and then eventually she gave me the diagnosis of New Daily. And that was probably somewhere, I think, late spring of
Mhm.
18, going into the fall. Um, but didn't change how I was being treated because unfortunately there are no meds specifically for NDPH. There's no research specifically for NDPH, especially at that time. So I'm kind of at the whim of what they've come up with for migraine.
Mhm.
Through all that, CGRPs, like I said, the Cephalid, Nerivio. So I probably did over 50 different meds, devices, tests. I'm probably up to 60 by now.
Oh, wow.
uh,
Okay.
Finally, let's see, in 19, my doctor said at that point, my local neuro, she was a headache specialist. It was basically out of options for me as
Mhm.
far as what she can do out of her office. So she said, you need to go to a clinic.
Mhm.
She happened to have been a fellow at Jefferson, referenced me up there, referred me up there, saw Dr. Silverstein, and then started all the inpatient infusion things of what they normally, through their process. So that summer of 19, I did DHE infusion for a week, got a few months out of it, and then it just kind of petered out. That December of 19, I had outpatient infusion at
Mhm.
Jefferson, which basically meant it was only a 4 or 5 hour infusion instead of 24/7. Did that for a few days, left there, got a little bit of relief, but not much, less than a couple of weeks probably.
Mhm.
And COVID hit a few months later, and I'm just like on the couch. I ended up in 19 retiring from my job,
Oh,
which
wow.
was about 3 years earlier than I anticipated or hoped for. Uh,
Mhm.
you can make the connection. And so in 20, I'm like, I'm not responding to any medication. I'm not getting help. Finally went back to Jefferson in June for the inpatient DHE again during COVID, which was challenging. Got zero. Yeah, I got zero results out of that.
Oh.
And that's when I was, I'm still working my other neuro. We're trying, if anything new comes out, we're getting it approved, or we're getting samples, and nothing. It's pretty well known for NDPH that it's extremely refractory to any kind of medication. So for me not to have, this was not unusual for me not to be responding.
Right.
Let's see. So that fall of 20, I think I started Vyepti. That didn't work, and then they started putting me on Qulipta and things like that. Not Qulipta, I'm sorry, Cymbalta, up to like 60 or 80 milligrams a day, and I didn't do anything either. At that point, I'm like, I'm done. And then I started reading about psychedelics and pain, and I was reading about clusterbuster, reading different doctors, neurologists who've done some speeches about psychedelics and pain and headache. So I started looking towards that, started doing all my research into that. And in February of 21, I did my first intentional psychedelic trip with help of a guide, a coach, that worked with me for probably 9 weeks before she let me take the medicine. And the next day I had 50% lower pain levels. So I got down to about a 4 of a base, which was good for me. I was at 6 or 7 probably on a daily basis.
That's what I was going to ask, is what was your average pain level?
Yeah, and average is exactly what it means. Problem with NDPH is the headache doesn't go away, the pain doesn't go away, the symptoms don't go away. Mark mentioned, Dr. Burish mentioned, or you mentioned migraine symptoms as well. And I don't really consider them migraine symptoms. I just consider them additional symptoms to my NDPH, which is probably number one is barometric pressure changes. Number 2 is probably photosensitivity. Then you go into sound, and you go into nausea, and they're pretty much wraps up. And they don't go away. They stay with me just as much as the headache does. So, the old expression is just not a headache, refers to NDPH as well.
Right. So I should mention, you mentioned Cluster Busters. Cluster Busters is a nonprofit organization organized by cluster patients, and they are well versed in using psilocybin to help treat cluster headache, which is known to be the most painful condition on earth. And they often have resources where they can help people like Alan, who have failed other treatments have failed them, I should say. Every treatment's failed them when they have severe and consistent pain like NDPH. To see if psilocybin helps them, and they are an association that helps to research psilocybin and head pain. So for people who are not aware of that, that is what Alan was talking about when he mentioned cluster busters and psilocybin, and having a coach help him figure out how to use psilocybin to treat his pain. And so we got to your pain level, what it was, and how you did have to stop working, etc. So we got a very good of an indication of how much NDPH has impacted your life. So Dr. Burish, is NDPH more difficult to treat than some of the other headache disorders? Is this just a known fact?
It does seem to be harder to treat for some patients, for sure. That may be because it's a relatively new headache, and like Alan said, we don't have a lot of data on how to treat it. It's probably been around for forever, but the term was first used back in 1986. I mean, this is a fairly new kind of thing, and migraine's been around for over a century. So we definitely need more research. Right now, we try medications for what the headaches look like. If they have kind of migraine features, we try migraine medicines. If they have tension headache features, we try tension medicines. But they weren't specifically designed for NDPH. We're just doing the best we can.
Right. Do we know what percentage of people who are diagnosed with NDPH are able to find relief?
Yeah, it's a good question. It does, we don't know. The answer is we're not sure. It does seem to depend a bit on age. So
Mm,
if you get it when you're young, sometimes it's a little bit more likely that it will go away after a period of time. If you get it when you're older, sometimes it kind of lasts more long term.
mm,
I've definitely seen all cases. I've seen cases where patients respond to the migraine medicines very well. I've seen patients where nothing really helps and it's gone on for years. So it kind of takes a lot of flavors. It's hard right now to predict any one particular patient what it's going to be like.
And what is the average age that people are diagnosed with NDPH?
Ooh, for average age, I don't know. It's basically, I think, for teens or even preteens, all the way up to kind of older age. I think it's pretty wide
Okay.
range, but I don't know what the most common is.
Okay. Um, so, Alan, what made you decide to start NDPH Aware? Obviously, it was your suffering. Do you have anything else that you can say about how you started this nonprofit? Because that is a very impressive thing, to take your suffering and turn it around and go on and help other people.
I appreciate that. Thank you. So after I had my first experience with psychedelics, I started reaching out to the doctors that made the videos and the conferences. And then I started, of course, I was reading about Clusterbuster. So I reached out to Bob Wald, the founder,
Mhm,
and I reached out to Eileen Brewer, who's the president, to
mhm,
figure out what just happened.
mhm.
Why is this working? What is it doing for me? And how do I go about trying to figure out some kind of a protocol that will be sustainable, which I
Right.
haven't, which I have not found.
Okay.
Um, and they called me back like immediately, because at that point, Clusterbusters was looking for other people that maybe have had similar experiences to the cluster community with psychedelics that they can help
Mhm.
get the word out as well. So it kind of ended up being kind of a real, kind of a karma thing where we just kind of all came together, and they offered me some space within Clusterbuster to join them and put something together for NDPH. And at
Mhm.
that point, I was like, yeah, of course, something's got to be done. I can't live like this, and neither can the other. We think somewhere between 300,000 and 400,000 people in the United States that have it.
Right.
Um, that we need something that has to be done. We just
Mhm.
can't be. We can't just not have any meds that could be approved for NDPH. So
Mhm.
that's kind of started the whole thing, and then in September, I got invited to do a webinar with AMD, American Migraine Disorders,
Mhm.
um, and I was on that, and then I went to the Clusterbuster conference after that, and things just started rolling, and it's getting things going and figuring out what to do and how to do it and setting it all up, and so August of 22 is when we actually really released NDPH to the world, NDPH Aware to the world. So we started
Mhm.
a website. I started a Twitter page and a Facebook page, and
Okay.
yeah, and that's kind of how we got going.
And what is your website? It's ndphaware.org, correct?
Yeah, everything's under ndphaware.org. Keep it kind of simple,
Okay. Okay.
easy to find, and
Okay. So let's talk about the research study and the NDPH patient experience survey, because we want to make sure that anyone who's listening and is able or who is qualified can go take this survey and be part of this research study. So what are the goals of the survey, first of all?
I'll take the initial part, and Mark can talk about what
Okay.
happens once we get the data.
Okay.
So after talking to a lot of people and figuring out, okay, I have an organization, nonprofit, what do you do with it? And there's different ways you can go about. You could do the social media, um, support group type thing, or go behind the scenes, which is kind of what I was more into, trying to get the research, trying to get the education out, trying to get the advocacy going. And everybody I spoke to said the first thing you need is a survey, because no one knows who the community is, who the population of NDPH patients are, what the experiences are, how old are they, what the percentage, the demographics, all that stuff. How many meds, like you asked, how many meds have they taken, what's worked, what's not worked.
Right.
So we figure we need to figure out who these people are before we can figure out how to help them. And we talked earlier about what NDPH is and how it starts. Mine came out of nowhere. It seems that a lot of people, and that I've talked to people who have gotten it through like an Epstein-Barr virus. People have gotten it through a concussive event. People had it, because of a surgical event. COVID now is probably the biggest single cause I would think of COVID, of NDPH at this point, or persistent or persistent headache. So we have a lot of people with varying symptomology and various, how they end up getting to this point. And so we had to figure out how do you treat them all the same, or you treat the previous disease to try to stop the current disease, So here we are. We have a survey. We were able to get 4 other doctors on board besides Mark. We have Dr. Amy Gelfand, Dr. Christina Spurka, Dr. Matt Robbins, and Dr. Randy Evans, all on board, helping out to design the survey. And so we make sure we're getting all the right questions answered, so that those 5 people can figure out what to do with those answers.
Okay.
And I think Mark can probably explain more about that.
Okay.
Yeah, I mean, this was, Alan's idea. We met at a Cluster Busters conference, and he's really sold me on it, because I do a lot of cluster headache research. But he came to me not just saying, I think I want to do something. He said, here's my plan. Here is my survey questions. Here's what I want to do. And so I've just been happy that, to help. I think when it's patient generated, when it's patient, kind of driven, it's a lot more productive in a lot of ways to get patients to take it, to get patient to understand what it's about. You're doing it for your own community. So I've just been happy to help. But the idea for this is exactly what Alan said. We're trying to kind of define the problem, and then use that. This is not a one-off type of thing. Then use that to build things for advocacy and for more research and for clinical trials and kind of along those efforts. So it's an online survey. It's a one-time online survey. It's got questions kind of that run the gamut from, basic, how old are you? When did your headaches start? What did was there something that started the headaches? All the way to what treatments have you tried? How effective were they? How burdened are you by this disease? So we kind of try to run the gamut for things we're looking at. And so we just have patients log in. You have to be diagnosed with NDPH by a doctor, but we don't have to diagnose you yourself. Okay,
so you have to have a diagnosis of NDPH. How old do you have to be?
13 or older.
At
least as of now, we've got a couple things we got to double check on, but 13.
Okay. And then are there any other requirements to take the survey?
Internet access, I suppose.
Okay. But, and where do they go to take the survey?
We can give you a reference or something to link to, but it'll be an online, just an online link that they go right there.
Okay, so we have the link. We're going to be putting it up for you to see. And if you have any questions or problems, please be sure to contact the NHF, and we'll make sure that you get there, you get to the correct place to take this survey. So is there anything else you feel our audience should know about NDPHaware, or the NDPH patient experience survey before we go today?
I just want to encourage as many people as possible to take this. I mean, I think in my mind, I came up with a number of like at least 300 people to do it, but I don't know what actually a good number would be to be a solid survey with good data. I think it's got to be at least more than 2. So I'm kind of hoping that we get at least that much and more. It'll be on my website. It'll be on social media. The link here. Plus, also working through all the organizations that I'm part of CHAMP, and then hopefully they'll be able to help move that, and all the other doctors will help motivate it to their patients as well, and hopefully we get a really robust response to it. It's what everybody's asking for. It's like, where's the medication? Why aren't people talking about NPH? Why is migraine the big word and
right
H is not? And
right.
and things like that. And the patient community feels like they're a little bit left out.
Right. So if you have any trouble, or if you're listening to us instead of watching us and you cannot see the link, please be sure to go to ndphaware.org to make sure you get to the right place to take this survey, because we don't want anyone left out, because there's not that many people in the NDPH community to begin with when you compare to the migraine community to study. So if you do have NDPH, be sure you go and you take this survey. Anything else before we go, Dr. Burish, that you'd like to add?
No, I think one of the things that Alan mentioned about COVID is kind of fascinating. It's kind of a new wrinkle in the NDPH that will be exciting to figure out, that there are definitely triggers. Patients have an infection or they have a surgery, like Alan said. And there's a question of whether some of these long hauler kind of COVID patients, where they have this long COVID, is some of that actually NDPH?
Right.
What does that tell us about, it's a lot that's been studied obviously about COVID. What does that tell us about how this works? And can we use that to figure out how to treat other patients? So I think that's going to be fascinating.
Yes. And that we did have an episode recently on headache post COVID diagnosis. So everyone hopefully is primed with information on that. So, well, thank you, both of you, for joining us. Thank you, Alan. Thank you, Dr. Burish. And thank you, everyone, for listening today. And if you do have NDPH, please go take this survey, and please check out NDPHaware. Check out the website, check them out on Twitter, and check out the Facebook group. Thank you so much, everyone. And please join us again next week on Headwise, the weekly videocast and podcast of the National Headache Foundation. Bye-bye.